Hey, I'm Dr. Paul, and every day in practice, I could post 4 or 5 stories that I heard that day about patients' medical advice they were given that is ridiculous. And not only ineffective, but a lot of times dangerous. And it's one thing if it's like the crazy neighbor lady or the family member who thinks they know so much, but it's usually coming from their medical doctor. And listen, I have medical doctors as friends, and they're great, but you really have to be careful with the information you're getting, because a lot of it is not only ineffective, but can be dangerous. This week I had a lady come in, probably about 65 years old. She was in tears because she went to the doctor, and her doctor told her that her bone density showed that she had osteopenia. And osteopenia is not osteoporosis, it's below that. It's an indication that you have less than optimal bone density, but you're still not at risk of a fracture and you don't have osteoporosis. But freaked her out about it. Told her that she should not carry the dog food down the steps anymore, that she should stop cutting her grass with her push mower. She even said that she should not go to the chiropractor because that could be dangerous. And the reality is, all of those aren't only inaccurate, but they're the exact opposite of what would most benefit this person. So when we talk about in terms of osteopenia, in medicine, there's not just these conditions, there's preconditions, because, like hypertension, high blood pressure, well, you have pre-hypertension, diabetes, pre-diabetes. And osteopenia basically is pre-osteoporosis or possibly pre-osteoporosis. And what that does is open up a whole new avenue of something that they can treat and prescribe medicine for. Because osteopenia, at 65 years old, more than half of women have osteopenia because as we age, we tend to lose some bone density. But the thing about bone density is the only way to increase bone density is to put the body, those bones, under enough pressure that the body feels the need to strengthen those bones. So if you are inactive, you lose bone mass. And the more active you are, the more bone mass you're going to have. Astronauts, when they're in space, if they're up there long enough and they come down, they are osteoporotic, because in space the body says there's no gravitational pull, we don't need thick bones. So why expend that energy there? So it actually weakens the bones because you don't need thick bones. And as soon as they hit the earth and get into that gravitational pull and they hit the ground, the body starts to lay down bone because the body needs more bone in that situation. So a lot of women especially are taking the calcium and the vitamin D and the magnesium. These are things you need to produce bone. But you can take all of those things and it won't matter if you don't give the body a reason to lay down more bone. So if I want big biceps and I drink a bunch of protein shakes, that's great because I'm giving the body protein, but the only way my body's going to build muscle in my biceps is if I put the bicep muscle under tension and strain and break it down through workouts. And then the protein can be utilized to build up that muscle. That's the way the bone density issue is. We don't have a calcium deficiency. We kind of do, but more importantly, we have an inactivity issue. But this doctor told her to stop doing the very things that she needs to do to get the bone density that she needs, or to maintain the bone density that she has. Osteoporosis isn't painful. Osteoporosis is something that increases your risk of fracture, and it can be a big deal. But they want to give you medicine for those things, and medicine will not substitute putting the body under strain and load under weight-bearing exercise. And the medicines they're giving come with a lot of risks. And the only real risk of osteoporosis is increased fracture. And if you look at the side effects of a lot of these drugs, it's increased fracture. I have a buddy that's a dentist, and he will not accept patients right now if they're on these medications because it softens the jaw bones and the work he does won't stay put or won't be effective. That's a major concern. You shouldn't have to rob Peter to pay Paul. If you take a drug to build bone density and you do build some bone density, but at the expense of other side effects, you're going to have problems. They're not talking enough about the fact that you need to exercise with weights under strain, under load, so that your body has the ability or has the need to lay down more bone density. And when a doctor tells someone to stop doing those things, first of all, she's not at risk of fracture with those things. And if she falls, anybody's at risk of fracture. But she was doing the very things that she needed to do, and hiking. That was another thing. She hikes. These are the things that she does to build bone density. She's one of the healthier 65-year-olds, 66-year-olds that I know. Yet this doctor is almost trying to sabotage her. I consider it malpractice almost, because she's telling her to stop doing the exact things she needs to do to build the bone density that the doctor seems to be so worried about. I don't get worried about osteopenia. That's pre-osteoporosis, because most people as they age are going to have that. So pay attention to your doctor. I could post 5 of these every day about the crazy stuff I hear that people are getting recommendation-wise from their doctors. And I don't want to be frictional or controversial, but I'm telling you, it's not working. And you have to be careful who you listen to. So, women, if you're worried about bone density issues, and you should, be more active. Lift weights. Put your body under strain. Put it under force, so the body has a reason to build stronger bones. And when these doctors are telling you things that don't add up, please, you got to question this stuff, because it's going to be at your detriment if you follow the path that these doctors are laying out for you in many, many cases. So, sorry, kind of a negative post, but this lady was in shambles. She was so upset because this doctor had tried to tell her to stop doing the very things that she loves to do and has to do, and for no reason. In fact, it would have the direct opposite effect and would cause her harm. So, have a great weekend. Go put your body under stress, under load, build muscle, build bone density without drugs. See ya.